Hey everybody, welcome to our weekly podcast here at Sandstone Care in the DC area. This week we're really excited to have Andrew Darby out here. Andrew, thanks for coming in.
Thanks, Drew.
So we're going to talk through some of what makes your practice kind of special and some of the things that you're seeing in the field today, and hopefully give our audience a better idea about what you're doing and how people can get in touch with you and the work that you're doing out there in the field. So maybe start by telling us a little bit about what your background is and tell our viewers how you got into the field that you're in.
Sure. So I got into the field probably about 15 years ago. I was really interested in mental health and psychology, social work, and so what I ended up doing is I went to school, which is what one does when they're interested in getting to the
that
field.
Happens, yeah.
And so I really focused in on how I could help people who are struggling with mental health concerns. I went to school, I did all that schooling, and then I got into the field by working in a variety of different places. A few of them were hospitals and institutions, other ones were more outpatient clinics. Recently I got into more substance abuse specific treatment about 6 years ago, and I worked my way up to clinical director. I've been there for 2 years at the Colmac Outpatient Recovery Center as the clinical director, and so that has been my journey. I've worked with young adults, I've worked with children, I've worked with people who have developmental disabilities, I've worked with people who have trauma, anxiety, and other mental health concerns. So really a lot of different things I've worked in.
Yeah, pretty well rounded there. A lot of experience. And so now you're launching kind of full into private practice, is that right?
Yeah,
Nice.
So I recently opened up my private practice. It was about a year ago. It's called Darby Integrative Counseling, and so I've been serving the community and clients 13 years and up, really focusing in on trauma, other mental health concerns such as anxiety, depression, and substance abuse is another, of course, a core component of the work that I do.
Nice. Very good. And that is located here in the Montgomery County area in Maryland?
It is. So it's in downtown Silver Spring. Really nice, convenient office with a great garage right next door.
Nice.
I think one thing that's really important about my practice is I take all major insurances, and I really am a pro-insurance practice.
That's awesome.
I really believe in being able to help people to access mental health care. And it's not just about having a problem, it's about growing as a human being. And I think really that's what therapy helps us to do. And so I want that to be accessible to as many people as possible.
Awesome. And that is really hard to find, as you know, obviously, good, solid clinicians at an individual level that are willing to take that risk, particularly in the DC metro area.
Yeah.
So that's awesome that you're taking that insurance. And I know we appreciate it being focused on accessibility as well.
Yeah.
So that's great. And what are the other kind of unique aspects of what you do, or who are the typical clients that you're seeing in your practice or specialize in treating?
Mm-hmm. So I really believe in treating the whole person. And so that's why I named my company Darby Integrative Counseling, because it's really about a holistic perspective on clients and what they're coming in with. So it's not just about the symptom that they're presenting with, such as the anxiety or the depression. It really is about looking at their entire being and how are they taking care of themselves? What is their nutrition like? What is their physical activity like? What providers are they connected to? Medical, psychiatry, any other holistic medicine providers, and their social network. What are they doing socially or not doing, and what's getting in the way of them being able to access these different forms of resources? So I think that's something that I really believe in at my practice, is really looking at the entire history of a client as well as the current presenting concerns.
Nice. Yeah, that's awesome. Really well put. I agree with you. I think it's the whole person. How can we look at everything that's going on with them? And I think we all do a biopsychosocial assessment, right? But how many people actually then create treatment plans that reflect all those different areas? and I think that's pretty rare. A lot of times we focus in on one and kind of forget those other pieces, so that's great. What would you say you're most passionate about sharing with our audience today and the folks listening to this, and as far as, you know, kind of your area of expertise and the industry as a whole, whether it's the addiction industry or mental health, or what would you say you're most passionate about sharing with our folks?
Sure. I think what I really feel most passionate about is I love working with people. That is why I got into this field. I wanted to help people, and that's why I want to do this work. I think in the field of addictions and mental health, I think what I'd really like to share is that people can get better, and they do get better. And even if it's not about getting better and it's just about becoming a more awake human being, that is what therapy is there for. And that people aren't sick or bad, that they're just struggling, right? And that we all have struggle, and getting therapy is one way to help us through that struggle or that difficult time in our lives.
Totally, I agree. And so what would you say, kind of as far as our particular industry with addiction and mental health, what forecasts do you see as somebody that's been working in a variety of different types of agencies and focus areas? You've served at like management and director level positions. Where do you see our particular industry kind of heading, and what forecasts can you provide?
So I really believe that a lot of our clients come in because of the symptom, right? The substance is the problem, and not really seeing other areas. And when they come into treatment, we have the opportunity to explore other areas that maybe were problems for them that they weren't even aware of. I think the next thing in the field is going to be really looking at the process addiction. So looking at behaviors that people become, we can call it addicted or compulsive, or we can use, you know, some of that language, but really it's about ways in which people feel like their behavior is out of control. So it might be gambling, it might be sexual behavior, it might be eating, it might be connected to sex and love. So there are different ways in which people can become addicted in a behavioral sense. And so I think that really is the next step in the addictions field. I think another piece of the field is really that continuum of care, and looking at this staying in the environment, right? So a lot of times we refer people to inpatient treatment, and it's not necessarily always the case that they need to be going. Now, if they are a danger to themselves or others, of course they need to be inpatient. But if they are able to remain outside of an institution and work in their own community and learn to recover in the community, I think that is the best place for them. So I think that's also the next step in the addictions treatment field.
Yeah, I mean, I think right now where we're at is folks have relied on residential so much that perhaps, and there, like you said, there's going to be those folks that meet medical necessity and things like that, but perhaps if the quality of outpatient centers and the individual providers continues to rise and be able to meet clients a little bit better with where they're at, we might see better outcomes associated with starting in lower levels of care. And obviously, we know that statistically speaking, the longer somebody's engaged in treatment, the better their outcomes. And so what better place to do that when they're going to be most comfortable, you know, continuing to remain in their homes without having to change, you know, their job potentially and things like that. So awesome. And what would you say, kind of, you've hung out with us a few times and know a little bit about Sandstone, and for our viewers that maybe don't know as much about Sandstone Care from another professional standpoint, what are the things that you might share or some of your impressions of what Sandstone does?
Sure. I think that Sandstone is a cornerstone of the addictions treatment field, especially here in this area as well as in Colorado. I think what I've found is that it really is very innovative. So you bring in a lot of different perspectives and a very holistic view of clients, as well as compassionate care. And so I really am honored to be able to refer to Sandstone, as well as to be able to work with y'all in the community.
Great. Thank you for that. It's very nice. And finally, just wrapping up, and if somebody wants to learn more about your practice in the Montgomery County area, where can they go and find more information about you?
Sure. So you can always Google Darby Integrative Counseling. You can find me on Google. You can also find me on Psychology Today. It's a really great website to find any therapist or psychiatrist that you're looking for. Or you can give me a call at 301-960-8694.
Awesome. Well, thank you everybody for joining us today for this podcast. Andrew, thanks for coming out.
Thanks, Drew. I appreciate it.
We'll see you guys next time.
Take care.